welcome to today's presentation. Today, I would like to introduce you to Dinesh Gambhir. Dinesh Gambhir is the founder and CEO of First Outcomes. First Outcomes is building the first artificial intelligence operation platform for healthcare. The genesis of First Outcomes comes from Dinesh's consulting work in value-based care, during which numerous administrators expressed their inability to manage the administrative burdens imposed on them by payers in four-letter words. Dinesh is a serial founder, having helped co-found Health Expense and Navtar. He is an alumnus of Deloitte Consulting, HP, and Ernst & Young. Dinesh has a PhD in computer science from NYU and was a NSF Presidential Young Investigator. Let me go ahead and introduce you to Dinesh. Dinesh, are you there?
Here, how are you?
I'm good, thank you. How you doing?
Doing absolutely great.
Okay, we have a few questions. Our first question is, why healthcare software?
We're focusing on healthcare because surprisingly, healthcare software has not made any advances as far as the patient customer is concerned. And I really want to emphasize customer, because when we look at all the things that happen to a patient, it's never focused on making sure that patient is happy with the service they're getting. It's always about pushing them from one thing to the next thing and then getting them out of the appointment or getting them out of the hospital. For us, we're bringing in the patient aspect of satisfaction. That is, we want people to be happy going into physician practices. We want them to be happy with the experience they get. And software just isn't there right now that does so.
Okay, great. And I see, Dinesh, that First Outcomes clients include primary care practices, multi-group practices, and specialists, but no hospitals. Why not?
Quite simple. Hospitals have a lot on the go. 95% of what hospitals do is focused on within the hospital. And I'm saying 95%, most of us don't realize that hospitals have mega ambulatory practices. Most hospitals have 500 or more providers that are seeing patients outside of the hospital, yet they're fixated on all the things going inside the hospital. It's a lot easier for us to go directly to the practices and say, we have something for you. Are you interested? And what we found was the practices are actually screaming, yes, 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 please come and help us. The government regulations have gone up. The revenue per patient has gone down, and they're being asked to do more and more. So when we say we can help them, they're absolutely ready to work with us. Now, with SmartSource, we're going after the hospitals, but we know it'll take time just because their attention is so focused on everything that's happening within the hospital and less so within the ambulatory practices.
Okay, great. And what makes First Outcomes unique?
Our uniqueness really comes from our understanding of what happens within healthcare. I actually myself spent about 6 years consulting within healthcare to understand something called value-based healthcare, where people are actually paid, that is, practices are paid for outcomes. You get better, practices make money. You don't get better as a patient, practices don't make money, which seems to me the right way to practice medicine. Yet, most people coming into it from every other company don't understand about value-based healthcare. They don't understand what's driving the internals of practices. We do. When we go in, we can talk to the administration. We can talk about clinical ops. We help improve clinical ops. We improve the customer interface, that is how patients, and you'll see this word customer. We don't use the word patient because we really feel that you need to take care of the patient like you would a customer. Sometimes that gets lost. And we take care of every person within an ambulatory practice. How can we make their jobs less mundane? Some people are on the phone just making appointments with patients 8 hours a day without break. That is a mind-numbing job. We make those jobs better. We allow them to actually focus on care while allowing automation in our case, hyperautomation, the bots to take care of the mundane part of setting up appointments, making sure people come in for appointments, helping them to find the way to the practice.
Okay. And what are you most afraid of?
What we're afraid of is that we'll get lost in focus. Our focus right now is two things: make life better for the patient, the customer, and two, make life better for everyone who has an administrative task within clinical operations. Instead of giving them mind-numbing tasks, we give them tasks where they are excited to come in. They're actually helping patients just like a physician would, but it might be educating the patient. It might be checking in and making sure the patient is recovering well from their operation. It might be a dental extraction that happened and they're checking in. That doesn't happen right now. And I never want to lose that focus on why we're here.
Dinesh, that was great. I want to thank you for joining us today and sharing your thoughts on the future of artificial intelligence with our viewers. The benefits that are available now for healthcare providers is very clear. An improved patient experience with a more efficient work staff. A live demo of the bot communication system that Dinesh described today can be arranged by contacting David Conley, the Director of Healthcare of SmartSource, who is a strategic partner of First Outcomes. His phone number and email are both listed on the screen now. My name is Adam Klingsheim. Thank you for joining us, and we'll see you next time.